Good morning, everyone, and thank you for being here. On behalf of Protect Our Care, I'm John Simoes, and I'm honored to welcome everyone today as we mark the last day of Medicaid Awareness Month. And we'll be doing that by calling attention to the rising threats to healthcare access here in New Hampshire, especially for communities of color, for mothers, for Latino families, and for people with disabilities. Recent national reporting has made it clear that proposed Medicaid changes would disproportionately harm Black and Latino communities. Here in New Hampshire, we're already grappling with deep systemic disparities in our healthcare system, and these new policy changes risk making them much worse. I've got two folks to talk about this morning in the conversation. I'd like to first introduce Dr. Marie Ramos, who is a family physician and a health equity advocate with expertise in community medicine and public health policy. She currently serves as the president-elect of the New Hampshire Medical Society and as a board member with the Endowment for Health. She's a key voice in addressing structural disparities in care across our state. And Kristen DeVideo is joining us as well. She is the founder of Putney Consulting, where she specializes in public communication for behavior change around critical public health issues. She's also a board member of the Social Marketing Association of North America and is a nationally recognized expert in public health media strategy. Thank you both for being here. This is a big topic to unwrap, and unfortunately, it's one that just does not get enough attention, and it should. I'd like to start by asking Dr. Ramos, what would the loss of Medicaid funding at the levels we see today mean for communities of color in our state? And how are proposed Medicaid cuts also likely to impact maternal health and access to maternity care here in New Hampshire?
It's a great question, and thank you for having me today. Well, New Hampshire has about 200,000 Medicaid recipients as of the end of last year. And our numbers are proportionate to what we see nationally as far as the BIPOC population, Black, Indigenous, people of color population within the state. And so that means that tens of thousands of Granite Staters that are persons of color or in historically excluded communities will lose access to Medicaid. What that means is not just maybe the typical person we might think of, but that also means hard workers, people that are holding full-time jobs, sometimes 2 and 3, in order to support their families, younger families, as well as older individuals that have disabilities, as you mentioned before.
Thank you. Kristen, I'd like to ask you first, if you have anything to add, please, feel free to. But my question to you is, given your expertise, can you share an example of a public health campaign that was successful in shifting public awareness around access to care for everybody?
Thank you very much. I'm glad to be here. There have been a number of campaigns to raise awareness around access to care during the expansion of the Affordable Care Act. Then there were separate Medicaid expansions. These are all nationally. And then a number of states rolled out state-specific care expansion awareness campaigns, depending on each state's laws and how they expanded it. In New Hampshire, I believe Covering New Hampshire was one of the campaigns that helped to raise awareness. And while there is a level of success in raising awareness, what's very important is to look at specific campaigns that can target individuals who historically have been excluded because they face different barriers to accessing care. They face different types of stigma. There may be distrust in the community, and there may be culturally appropriate messaging or messengers that need to be included in the campaigns. And so while we have done a really great job, it's so important now that we do a better job and include people's voices.
Thank you. I appreciate that. Dr. Robbins, my next question is, would you help us understand how disparities in access here in New Hampshire, how these disparities work, and how these disparities ultimately affect everybody in the state?
I think it's important for folks to understand that, particularly with primary care, access to primary care is the gateway to healthcare and prevention. And we already have a dearth of primary care access in general. And this is across all boards, particularly affecting our urban areas, but also our rural areas. I'm thinking about North Country and with hospital consolidations, for instance, and our valley area. And so it's very important to make sure that we are able to compensate clinicians in order for them to accept patients and keep their doors open, to be quite frank. So having Medicaid expansion and having Medicaid is a way of having access to high quality primary care. What we find is that when folks do not have insurance, they often delay care and they utilize our emergency room services disproportionately. And what that does is it might give a patchwork of support for a patient, but it doesn't help a person to maintain, sustain, and to live out the best forms of themselves. And there are downstream consequences to that. When we have delay in access or onset of care for prevention, that also means that patients are not getting their medications like they should. They're coming in and they're presenting much later and with more complications if they're coming in at all. And so it's very important that we're able to have this measure of access. Now, as far as disparities are concerned, we see that more often than not, our patients of color tend to still also have delay in onset of care for their chronic diseases. We see often that when they do present, patients of color or of historically excluded communities, they often do not get the same quality of care as well. And so it is very important that in New Hampshire as well, we see these same metrics across the board, zip code to zip code. And so what that does, though, is that means that we have less availability for productive engagement of Granite Staters across the state. And so it has downstream complications, not just from a healthcare standpoint, not just from an ethical and moral standpoint. There's a fiscal note to that as well.
Thank you. Thank you for that explanation. That's very helpful. And I'd then like to pivot to Kristen and ask, given your experience, what role does trust in the healthcare system itself play in addressing these disparities and closing gaps and making people aware?
I think many people are aware, but not everyone is, of unethical behaviors from the scientific and medical community in the past that led to certain groups of people where they were misinformed or uninformed about services and care they were getting. And when you've broken trust, or if there's trust broken over time, and you can look at studies around access to care and different types of treatment different people get, there is a legitimate history where there is a layer of distrust that's well deserved for many people. There are a lot of barriers to getting care, especially if there is stigma involved. Be all types of stigma. Of course, a lot of that around people that have a substance use disorder in getting care, right? Where there's, again, a lack of trust, or let's say they have a substance use disorder and they're going in for care, but they have children. That might be an area of trust where they're worried about, even though they want to get help for their disorder, they are worried about their children being taken away from them, right? There's so many different layers of things that are going on. And then there's also the barriers to care. Like, it's just because you have care doesn't mean it's easy to get to the care. It doesn't mean it's easy to find a provider that you trust, or that you feel is listening to you. And that goes for everyone. And then there's the barrier of the number of appointments, or if you are not only concerned about your care, but you're a caretaker for others. You may have an aging parent, you may be taking care of someone with a disability, or a child. And so there's just so many places for things to go wrong, for things to fall through the cracks, even with everyone really having the best intentions, that those are just like the layers that can add on to where it's so important to have a trustworthy messenger to support healthcare providers, the community health workers, whoever is the voice connecting the person to the care so that they can just access the care, like everyone else. Right?
Well, thank you. Thank you for that. That actually provides some real insight. And so I want to wrap it up on a final question for both of you. We can start with Kristen, then we can end with Dr. Ramos, which is, people are watching this. People are hopefully concerned about these gaps, concerned about the impact for everybody, and concerned about what happens next as we see cuts not only in Washington, but some real significant cuts in the service and access being discussed in Concord. So is there something that members of the public can do to get involved, to speak up for Medicaid and its importance and the Affordable Care Act as well, raising awareness in communities, but also what steps should our elected New Hampshire policymakers be making right now to protect and expand Medicaid access for everyone? So, Kristen, if you have anything you want to add there, then I'll ask Dr. Ramos the same question.
I think it's important for people to always speak up. And New Hampshire is a very interesting state where it's so small. We have so many representatives, but because of the way our government is structured, you really can get your voice heard, as an individual person in New Hampshire. That said, if you are just speaking what you believe to another person who has a different belief about whatever you're talking about, they have a barrier to hearing you. And so it's really important to understand why that person can't hear what you're saying, understand what their values are, why they don't support whatever expanded affordable care for people, right? It could be financially, it could be they actually need that service, but in their mind, receiving public access, there's stigma around it, or the people that receive that don't maybe work as hard, or there's so many falsehoods out there that are personal belief barriers that people are raised with. And so it's so important to understand why, and then find a way to communicate it in a way that a person can identify with their values, because really most people, in the end, if you spoke with them, do care about other people. And it's these ideals and systems that they have this mental block against in the service piece of it.
Thank you. Maria, anything to add to that?
Yeah, I want to highlight three key things as far as advocacy is concerned and overarching themes. So I want our listeners to understand that New Hampshire has one of the highest medical spending costs per capita in the country. And so we are in crisis. And so I think all Granite Staters are interested in making sure that we have longevity of healthcare for everyone. The second thing I want to highlight is the number one population that is covered under Medicaid are children. So the biggest population that we're saving and we're supporting are children in the state of New Hampshire. The third thing I want to remind our listeners is that the biggest identifiable intervention to unnecessary cost of care is prevention. And the way that we do that is by focusing on primary care and prevention support. That is what the Affordable Care Act has done. And as a result, the New Hampshire Fiscal Policy Institute has demonstrated a change and an improvement of access to preventive services, and therefore a reduction of avoidable hospitalizations and spending costs due to chronic diseases like high blood pressure, diabetes, for instance. These are things that affect all Granite Staters. Our population of minority or historically excluded Granite Staters, this is the fastest growing population within the state. And this population are hard workers, they're young professionals, they're families that are coming to the Granite State to work, to invest in our economy, and to provide additional resources for our tech and for our industry. So when we think about Medicaid and expanding Medicaid services and prevention, we're thinking about the foundation of what Granite Staters believe to be necessary to be the best form of themselves as a community. It is our proper duty as representatives within the state to make sure that all of us have the most opportunity to be the best forms of ourselves. And that's what you can do when you call your state rep. Your state rep, luckily, and your senators, they are your neighbors. Oftentimes, you run into them in the supermarket, and they all have access. We all have access to them directly. So you can reach out to your medical society, even your public health department, and I bet you they would be able to help you to get access to either email or even their telephone numbers, which are listed publicly, to let them know how important it is for you to make sure your neighbors are healthy. We don't want more taxes because we can't afford to bring people into our hospitals. And one of the ways that we can do that is making sure that we have expanded Medicaid.
Well, thank you both. I mean, that I think kind of sums up that it's not simply the right thing to do, it's a smart thing to do, and it's a good investment in our communities and in our own families. So thank you. I'm going to ask my colleague Rachel to hop on, see if we have any questions that have been submitted from media before we wrap up.
Thank you, Jaime, and thank you to Kristen and Dr. Ramos for joining us today and participating in this really important conversation. If you are here with us on Zoom today and have questions for the press, you can please drop those in the Q&A box at the bottom of your screen. And if you have a question directed towards a specific speaker, then you can note that in your question. We do have one question that was submitted ahead of time, and that is for either of you today. That question is, how would Medicaid cuts be especially detrimental for people of color in New Hampshire who suffer from mental health disorders? And would this increase an already present stigma around accessing care?
It's a great question, connecting, two things that unfortunately don't connect often enough. We are in a behavioral care crisis in New Hampshire. So either you'd like to answer, please do.
Sure, I can take, I can start, and then Kristen can definitely follow up, I'm sure, as far as perception and framing is concerned. Mental health and particularly substance use disorder, we got hit really hard in the Granite State. And we, as a result, leveraged a lot of funding to help with expanding mental health services to Granite Staters, which did help. There has always been a dearth of access for mental health services, particularly for people of color. One of that is a cultural thing. Many times in circles and in communities of color, just mental health is stigmatized. It's not something that people talk about. And the way that it is approached and treated is often negatively approached. However, also, we found in the Granite State, there's been issues as far as even having culturally appropriate messaging for patients that do not speak English as a primary language, which is a huge barrier when you're talking about sensitive issues and topics. Access to care is also important when it comes to our community mental health centers. And so, again, having broader reach for patients that may not have the privilege and the ability to take time off of work in order to go into rehab programs, for instance. But I would also second to say that the main source of mental health care comes from primary care settings. And so again, because like our community health centers, for instance, we often are a safety net for mental health support and services. Because there's a lack of access for that, that could also, be a detriment to our communities of color. And the last thing I would just mention is that we know that when there are people and clinicians that look like their populations, particularly studies have shown when there are African American providers that are in a zip code, then the life expectancy and the overall comorbidities associated with particularly African Americans or people that share that same background, it improves significantly. And so it would behoove us to make sure that we are creating an atmosphere within the state that supports all diverse clinicians and providers to come. One of those things I will say that has been very successful in New Hampshire has been public service loan forgiveness for our primary care and mental health providers. And so these aspects have been very helpful in creating increased access to care, particularly for our LGBTQ communities and people of color in the state.
I want to add to what Dr. Ramos is saying and what she's said before as well, because she's brought up so many good things. And one is when we look at the mental health access and availability of providers, and especially around children's mental health, who, as Dr. Ramos has told us, is the biggest population that's being protected by Medicaid right now in our state. There really is just such a gap that was made worse during the pandemic. And there are really so many things going on for children and young people. And even though there are health care providers that are providing the services out there, there's still such a wait to get in to see them. You have maybe a primary care physician who's providing behavioral health services. Maybe this child needs to really see someone who does specialize in Medicaid management. They may not be covered by Medicaid. There are fewer, and then there's a wait list. And it's just a very complicated issue. It involves everyone. It involves other adults that are non-traditional age family members taking care of children. And then there are schools that, and the community is trying to come together. There have been systems put in place, but there are still huge gaps. And to chip away at what has even been put in place now is just going to cause so many problems for the children and young people in our state that really are already suffering from not being able to access care when they need it.
Thank you. I want to thank Kristen Davidio and Dr. Marie Ramos for joining us this conversation today. I know that there's a lot going on right now. There's a lot swirling around, and so much of it seems negative. But to focus on what is within our control, to stay within our vision, our beliefs, and to speak up for our community is always the right thing to do, regardless of the circumstances. So thank you both for reminding us of that today. On behalf of Protect Our Care, thank you, and thank you to everyone who joined us today. Hope to keep this conversation going again in a few weeks, and I hope that we can all circle back in a few months and have good, positive results to report. So thank you, and I wish everyone a good day, and thanks for joining us.
Thank you.